This section covers healthcare delivery, starting with disease prevention. It's broken down by target population and goals. For primary prevention, the target is healthy people. The goal is to prevent disease onset altogether through measures like a healthy diet and exercise to prevent diabetes. For secondary prevention, the target is people in a subclinical, asymptomatic stage. The goal is to prevent symptom onset, for example, conducting glucose screening for type 2 diabetes mellitus. For tertiary prevention, the target is patients with clinical, symptomatic disease. The goal is to prevent disease progression and sequelae, reducing associated morbidity, mortality, and disability. An example is monitoring hemoglobin A1C to guide treatment and prevent complications in diabetes. For quaternary prevention, the target is symptomatic patients who are over-medicalized or have non-treatable conditions. The goal is to prevent overtreatment and iatrogenic harm, like discontinuing a sulfonylurea after a patient has had multiple hypoglycemic events. Major medical insurance plans. An exclusive provider organization, or EPO, requires you to get care in-network. Out-of-network coverage is only available for emergencies. A health maintenance organization, or HMO, offers lower premiums, but you are limited to in-network providers. It requires a referral from your primary care provider to see a specialist and generally has lower out-of-pocket costs. A point of service plan, or POS, is a combination of an HMO and a PPO. It allows for out-of-network care, but at a higher cost, and it still requires primary care referrals. A preferred provider organization, or PPO, offers flexibility for both in-network and out-of-network care, though going out-of-network costs more. It does not require a referral to see a specialist. An accountable care organization, or ACO, is a group of providers who voluntarily coordinate care specifically for Medicare patients. Finally, a high-deductible health plan, or HDHP, has low premiums but a high out-of-pocket cost. It is compatible with a health savings account, or HSA. Healthcare payment models. Bundled payment. The healthcare organization receives a set amount per service, regardless of the ultimate cost. That payment is then divided among all providers and facilities involved. Capitation. Physicians receive a set amount per patient assigned to them, per period of time, regardless of how much the patient uses the healthcare system. This is used by some HMOs. Discounted fee-for-service. Here, the insurer and the patient pay for each individual service at a discounted rate that is predetermined by providers and payers. A common example is PPOs. Fee-for-service. In this model, the insurer and the patient pay for each individual service without discounts. Global payment. The insurer and patient pay for all expenses associated with a single incident of care with one single payment. This is most commonly used during elective surgeries, since it covers the cost of surgery as well as the necessary pre- and post-operative visits. Medicare and Medicaid. Medicare and Medicaid are federal social health care programs that originated from amendments to the Social Security Act. Medicare is available to patients age 65 or older, patients under 65 with certain disabilities, and those with end-stage renal disease. Medicaid is a joint federal and state program that provides health assistance for people with limited income and resources. Here's an easy mnemonic. Medicare is for the elderly. Medicaid is for the disadvantaged. The 4 parts of Medicare are: Part A covers hospital admissions, including hospice and skilled nursing. Part B covers basic medical bills, such as physician fees and diagnostic testing. Part C combines Parts A and B, but delivered by approved private companies. Part D covers prescription drugs. Palliative care. This is medical care aimed at providing comfort, relieving suffering, and improving quality of life for patients with complex or life-threatening illness, regardless of their diagnosis or prognosis. Palliative care is often provided alongside curative or life-prolonging treatment. It is delivered by an interdisciplinary team, physicians, nurses, social workers, in hospitals, outpatient clinics, or even at home. Hospice care, also called end-of-life care, is a form of palliative care specifically for patients with a prognosis of 6 months or less, when curative or life-prolonging treatment is no longer wanted or beneficial. Types of medical errors. Medical errors can involve many areas: patient identification, diagnosis, monitoring, healthcare-associated infections, medications, procedures, devices, documentation, and handoffs. No matter the type, medical errors should always be disclosed to patients, independent of the immediate outcome, whether the outcome was harmful or not. Active error. This occurs at the level of the frontline operator, for example, when the wrong IV pump dose is programmed. The impact is immediate. Latent error. This occurs in processes that are indirect from the operator but still impact patient care. For example, when different types of IV pumps are used within the same hospital. This creates an accident waiting to happen. Never event. This is an adverse event that is identifiable, serious, and usually preventable. For example, a scalpel being retained in a surgical patient's abdomen. These are major errors that should never occur. A sentinel event is a type of never event that leads to death, permanent harm, or severe temporary harm. Near miss. This is an unplanned event that does not result in harm, but has the potential to do so. For example, when a pharmacist recognizes a dangerous medication interaction and cancels the order before it is dispensed. Near misses represent a narrow prevention of harm that exposes hidden dangers in the system. Medical error analysis. Root cause analysis. This is a retrospective approach. It is applied after a failure event to prevent recurrence. Root cause analysis uses records and participant interviews to identify all the underlying problems that led to the error. Tools such as the 5 Whys approach, fishbone or cause and effect diagrams, and process maps may be used. The analysis looks at processes, people, environment, equipment, materials, and management. Failure mode and effects analysis. This is a forward-looking approach. It is applied before process implementation to prevent failure from occurring in the first place. It uses inductive reasoning to identify all the possible ways a process might fail, and then prioritizes them by both the probability of occurrence and the potential impact on patients. Causes of medical errors. Burnout. This occurs with prolonged, excessive stress. It leads to emotional exhaustion, depersonalization, and reduced professional efficacy. Fatigue. Sleep or rest deprivation results in cognitive impairment and decreased attention to detail.